Hey guys, it's Dr. Kate, Dr. Chris from Pittsburgh Chiropractic and Wellness. We just wanted to come at you guys with another little quick live video. And today we were going to discuss tips and tricks on healthy digestion.
All things digestion, right?
Yeah, good stuff.
We hear it all the time. Folks have great digestion. Others are like, oh my gosh, my digestive system is a mess.
Well, and what does that look like? So what are some signs and symptoms that you might be having poor digestion?
Right, and how would we recognize this? I think a lot of times is, some of it might be pretty obvious, right? The food, whenever you eat something, it goes right through you. Right?
So,
liquid stools, big time. Constipation would be another one. Reflux, I think anytime we have acid reflux, that's your body literally just screaming at you to change what you're doing. Please change what you're doing.
you mean add more pills?
Well, you know, that's what they say. Like the purple pill, like the Prilosec, we cover it up, or with the medications, we'll take that medication to cover up that symptom.
That cures you, right?
No, in some eyes. Not ours, but others.
We don't want you doing that.
No, so I think constipation, diarrhea are pretty easy ones to figure out. Something that we don't like to talk a lot of, but if you go to the bathroom, if you have bad gas and it has a really rancid smell to it, obviously gas can have it, but if it's really foul, that can be a sign that the digestion is not up to par.
Yeah, so first, like I said, we want to identify that we might be having some of those symptoms or some of those signs, and then what can we do to balance our digestion and make it better?
Yeah, and as you're speaking, I think kind of the heartburn is the other one I think might hit a lot, might make sense to a lot of folks with the heartburn issues, and then recognizing what we can do to find out if our gut is an issue outside of if we find ourselves taking over the counters all the time to counteract what we're doing with our nutrition. That's how we would recognize maybe something is off. One of the tests we do in the office is a 24-hour urinalysis collection, and it's a fantastic way to look at your gut health. So what we do is you have a take-home kit, and you would collect your urine for 24 hours, which obviously you know, and then you send a sample out to our lab. It looks at vitamin and mineral deficiencies and toxicities. It looks at your gut health, how you're absorbing fats, carbohydrate, and what that looks like big picture. We do a urine dipstick, which looks at the major stuff such as protein or ketones or things in your urine, but the nitty gritty stuff I love. If you're dehydrated, overhydrated, it looks at that. Your calcium levels. It is a really, really cool test. Specifically, it looks for something called leaky gut syndrome.
Okay, cool. So you want to add on to that?
Yeah, I think with that leaky gut, which a lot of us, with this taking place with the gut issues, when you have a leaky gut, what that looks like are the things that we were talking about earlier with the digestive issues. And with that comes in kind of a prelude to what we were talking about on tips and tricks, how we can counteract those things, which is what you want to get into. Yeah,
I'm out of curiosity. Would you say that there's maybe a blood test too that would help check any of those things, or no?
So you can. I like urinalysis more specifically for the leaky gut issue. I think that gives me a better idea of what's going on. The Western medicine test, which other docs will look at, that's looking at disease processes that are already taking place. I always use the analogy, like our office is on Route 19, so if we leave our office, there's a car accident right in front of us. That's what that blood test does. It's like, hey, there's a car accident right here. Well, I get it. But if you were maybe at South Hills Village, 5 miles down the road, like, hey, there's an accident on 19 down here, you can avoid it. That's what our urinalysis does. I think that's the difference between maybe what that lab work looks like compared to what we're doing here.
Yeah, and maybe, too, it might look different as the treatment.
Correct. Yeah,
right?
The treatment where you're trying to avoid an issue as opposed to you already have the issue.
Right. And so how might that look different? How would we do foods and or drinks to help digestion naturally?
Right. And so I think we touched on this prior to what would you take? Kind of some things you want to talk about were kind of the tea or the fermented foods or things like that.
Yeah. So like mint tea, for instance, I love putting mint in even just water or hot tea. But mint in general is calming to the digestive tract. You could even chew on mint leaves. Yeah. If you're having an acute flare-up with digestion issues. So mint tea would be good. It has antioxidants and other vitamins that would really help with digestion. In addition to that, obviously staying hydrated, right? That's a huge one. Right. Just if you're dehydrated, it's not going to be as easy for your belly or your digestive tract to digest your food. So it's going to be crampy. It's going to be even sometimes bloating. It just depends. But dehydration is a huge thing, and it's an easy fix.
What would you recommend for the amount? Because somebody who might be 100 pounds should be taking, and less water than somebody who's 200.
Yeah, so a good rule of thumb is you're going to be wanting to hit a goal of half your body weight in ounces. So if you're 150 pounds, you can aim for 75 ounces of water. Still water. We want to try to avoid any of the carbonated drinks like soda for sure. But even like carbonated water because of the bubbles and the gas, because that could add to bloating as well. So still water is what we're aiming for. Half your body weight in ounces.
Got it. And then the other ones, not that we want to out-supplement a poor diet. I think if you're trying to supplements are never meant to be a replacement for something. Supplements are meant to do something in addition to. So nutritionally, fibrous foods, increasing your fiber intake, you should be going to the bathroom as many times as you eat per day. So if you're eating 2 to 3 meals a day, that's how many times you should be going to the bathroom. Unfortunately, I see probably a lot of you are thinking right now, like, I'm going once every 2 or 3 days.
Right.
It's just not the norm. And that's one of the ways you would know is that if your digestive tract is not up to par. So what foods would you recommend to somebody who needs to increase fiber?
Yeah, so a lot of these things are found in natural foods like broccoli and leafy green vegetables, spinach, things like that. Even apples with the skins left on. I know that whenever we have young children, we're worried about the skins and them choking, but we really get the most fiber and the most nutrition from the skin of the apple. So just make sure they're cut in small enough pieces or blended in with the apple is a great way.
Yeah, the increase in your fiber. So if you want to supplement with fiber, you could do that as well. Typically, you would want to get it in a fiber or in a powdered form. You would dilute it in water. You can drink that once or twice a day, and then the food options would be another alternative for it. Probiotics are another great one to take in. The problem with probiotics, there's a couple different problems with them. One is they're very hard to maintain the level of a healthy probiotic or a good probiotic. And your body gets accustomed to taking the same type of probiotic over and over again. So a probiotic, you would take that in the mornings on an empty stomach, and then whenever you run out of whatever brand you decide to take, this is one of the things where you want to invest in a probiotic. The cheap ones, you just urinate them right out. If you're taking a probiotic in the mornings, whenever you run out of that bottle, switch brands to something else. Have 2 or 3 brands in your carousel that you're switching between 1 month and another month. That way you're not taking in and introducing the same good bacteria to your GI tract over and over and over again. You can kind of keep it guessing.
Yeah. And to piggyback on probiotics too, the next thing I think of are like fermented foods. We touched upon this in our previous video. Things like sauerkraut. And you can even make these at home. You don't have to buy them. You can buy them, but you can make a lot of those things at home. So
yeah, pennies on a dollar for sure. That's the most bang for your buck. If you're able to do that, you can buy them fermented as well. Very easy to do. And that's one of the best ways to improve your gut health. We definitely do it. Fermented foods, couldn't agree more.
What are some things that maybe we should avoid? Or are there things that we would want to avoid if we're having digestive issues?
Yeah, I think so. Those symptoms typically, the stuff the standard American diet, right? The high sugar foods, the terrible carbohydrate foods, the really simple carbs, ton of alcohol, caffeine. Those are all foods that are going to really cause your very acidic. And those acidic-based foods are going to cause not only issues with your gut, they're going to dehydrate you as well. So it's a double-edged sword. Maybe
even dairy too. I mean, that adds a whole host of things like added sugars and things like that could be bothering your stomach.
A good trial for you to do out there is that if you're having any type of GI issues, you just want to do a test, do a 4-week test. Eliminate dairy and gluten for 4 weeks and see what happens. You would be surprised with how much inflammation takes place in dairy and gluten just by doing those 2 things, and it's not easy.
What are some things that you mentioned gluten? Not everybody knows what gluten is or what it is. Where do you find gluten?
Pretty much, you think anything you're going to put in your mouth, and if it just melts. So by that, so if you put a piece of bread in your mouth and it breaks down with you not swallowing, so your spit has an amylase to it, will break down that food. So if you put something in your mouth and it just kind of breaks down, so you think of potatoes, French fries, bread, rice,
cereal,
all gluten types foods.
Pasta.
Put a piece of broccoli in your mouth, what happens?
You gotta chew it up.
And that's kind of one of the ways you can it's an easy test for you to know, like, does it have gluten in it? Now you can have all those foods that are gluten-free, but you have to look for it specifically on the label. Potato chips, another one. Cupcakes, you can get the gist of it.
Yeah.
So those are the kind of things you would do, but you do it for just 4 weeks. And if you're having GI changes with that, you're on the right page. If you're not, then typically you're not going to be gluten sensitive, and then you can bring it back into your diet.
What about some of the drinks we said to avoid?
Yeah, so those ones are easy, right? The Gatorades, the high sugar stuff, the sodas. If you're drinking coffees, you're adding a lot of stuff to your coffee. So like the Starbucks lattes that are just loaded in sugars and pumps of various sugars, those types of things.
Not to mention too that coffee and caffeine in general is a diuretic, so it's going to rob your body of water. It's going to make your digestion even harder because it's a diuretic.
Yeah, it would dehydrate you for sure. All those things. So on top of that, what does it do? It breaks down. If you take soda and coffee, for example, it breaks down the enamel of your teeth. It changes the color of your teeth. Mm-hmm. So if it's doing that on the outside, imagine what it's doing on the inside.
Yeah, for sure. And so what can we do too as far as chiropractically speaking? Why would chiropractic have anything to do with digestion?
I thought
they're not connected, right?
I thought we were just back pain doctors.
Yeah.
That's all we did, right? No? One of my mentors taught me, we're going on practice. We went to school together. We're going on practice almost 20 years coming up. And one of my mentors, when I first got out of school, he said, you know what, Chris? We don't have Wi-Fi in our body. We are wired head to toe. And
old school.
Old school, right? So those nerves in your lower back, we like to think of sciatica, right? If you have sciatica pain, if we just work on your leg, well, you're not going to get any better. That's not where the cause is coming from. But that nerve in your lower back, not only does it shoot down into your leg, it also goes to your small and large intestine. So your lower back, we find out folks who have chronic lower back pain typically have chronic digestive issues.
Wow.
And the reason being is because there's a nerve that breaks off into that part of the organ as well.
Okay, so in addition to everything we talked about, in addition to removing some of the things that we should remove, adding some of the natural things we should be adding, you're saying that we should actually also be getting our spines checked to make sure that the subluxations are corrected, because that could be impacting our digestion as well.
Yeah, chronic misalignment in the lower back, we see a huge correlation with digestive issues.
And I'm going to add kiddos too. One of the biggest things we see with pediatric care is what? Our kid doesn't go to the bathroom regularly. They're constipated. And then what does the pediatrician do?
Pedialyte all day long.
Pedialyte and or other kinds of formulas and things like that. So what we like to do is we like to look at the source. We like to look at the spine and make sure that the spine is free from anything that's going to be blocking that signal to the digestive tract. So that's a really important thing with kiddos as well.
Yeah, get them checked. We always would say if our spine was on our face, we would take a lot better care of it.
Right. We
just don't see it. It gets neglected over time, so you can't see it, but you're part of your largest nervous system in your body, which is your brain. The only way it communicates with your body, those messages run down through your spine. So if you haven't had your spine checked, if you're having these chronic digestive issues, if you have a chiropractor that you like, know, and trust, definitely get checked out again.
Yeah, for sure. And so if there's something that we can do to help you here, either nutritionally and or chiropractically, we are your one-stop shop. We can actually help you in all those areas.
Yeah, we do many different things in this office, both with nutrition, with weight loss, with general health and wellness counseling. But if you haven't been checked at some time, we can definitely do all those things here in the office. We're currently accepting new patients, so if this resonated with somebody who needs to hear this message, pass this video on to them, we'll put a link down below this video as well where you can schedule.
We hope to see you guys soon.
Take care now.
Take care.
Bye.